This video is for informational purposes only and is not to be taken as medical advice. Please seek personalized care from a medical professional for your unique needs. Thanks for watching. Welcome, everybody. Welcome back to the channel. I am excited to talk with you today. We have Dr. Diana Mercado. She is a family medicine physician. She is an ADHD life coach. We're going to be talking about her story. We're going to be talking about ADHD in physicians, what she's up to today, and how she can help you. So welcome to the channel, Dr. Mercado.
Thank you so much for having me. Yes, it's a pleasure to be here.
Yeah, can you share with us your story?
Yes. So I'm a family medicine physician. I come from humble beginnings. My parents were immigrants. Were actually Mexican descent. Was born in Texas. My parents would get permits to come to California or to like Washington State to work for seasons in the produce fields. And I guess one time on the way back, I was born in Texas,
Mm.
but I grew up in Mexico till I was 10. And so English obviously was my second language. My mom, when I turned 10, said, okay, I'm about to have my third kid, and I can't do it by myself. Your dad works in Houston, and we're all gonna move to Texas. And it was South Texas, which to me it was only an hour away from where we were at, but obviously it was a world of difference. But it didn't feel like a world of difference just because in the same area it looked like little Mexico. We were all kind of Mexican anyways in South Texas. But it was a world of opportunities for me because because I was born in Texas, I was considered a citizen, and it was easier for me to be able to pursue my education, while some people sometimes cannot when they're immigrants and they're not of, that they're not residents or something of that sort. Anyways, education was always a way for us to kind of see the world or explore the world or um, stretch ourselves. I really was always curious about other people's cultures and I wanted to understand them. But again, I come from where my dad finally decided that he was not going to be working in Houston. He was going to be working in South Texas, and he became a welder. And he never completed past like third grade education. So for me to be all of a sudden wanting to go to college and to go to medical school, he was not against it, but my mom was more like, go, 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 do whatever it is in the name of education. But when I look back, I was always in trouble because I would do my work and I quickly caught up. Like I would jump grades like every 6 weeks because I was so interested in learning stuff. But I was always in trouble because I was disrupting the class. I would finish my work and then like I became the teacher's pet. They would give me more work, but I would finish that work and then they would give, because I liked it, I enjoyed it, but I was disrupting the class. So my parents would have to come and sit there for me to behave. Um, and I didn't realize that that was my ADHD. And because I enjoyed it, I was hyper focusing on it, and I was staying after school to try to like learn more and do more. And I was in trouble because I was so impulsive, because I would finish or I would just want to talk to everybody about what I just learned,
Yes.
even though they had not caught up with it. So eventually, I think my ADHD was not necessarily discovered right off the bat, or I was not aware of it because I looked around and my family was kind of like me. We would sometimes be all excited and rowdy. And I guess now I understand what emotional dysregulation can sometimes mean, where you can get, hyper focused on things, but then you can also kind of blow up when things don't go as planned. But then, like, it would just last a few seconds, and then you're back to your happy, cheerful self and on to plan A, B, C to get wherever you want to get to. And you don't make it mean a thing that you're taking extra step that maybe your classmates weren't, but you didn't realize they weren't taking those extra steps because again all those things were foreign to me. I was the first one to go to um, college in my family, and I come from a huge family. um, talking about my aunts and uncles, like in each side, I probably my mom had, eight brothers and sisters, and my dad had like 14. So like to be one of the first ones to go, like I didn't know what I was getting into, and so there was all this pressure on me. And I remember when I got my scholarship, I got it for business. Even I never thought I was going to go into uh, I thought I was going to do business, international business, because again, I was going to travel the world and see everything. I wanted to just eat the world up, all the cultures and everything. But I didn't even last a whole semester in international business, and I jumped to science. And I think I was just fooling myself, because all along during my sophomore and junior, I went to a program called Upper Bound Math and Science, and there is where I got to see firsthand shadow physicians and see surgeons and see all kinds of stuff. And that opened my eyes to that idea. Otherwise, I would have never gotten that exposure. And I could kind of see myself there. But I think I was a little scared to dream that big, because nobody in my family ever had that opportunity. But again, I got to go to this um, 6-week program. It was in Oklahoma when I was a sophomore and a junior. And I think that was what fully opened my eyes to the possibility of me even considering. And so I remember getting my scholarship and being put on probation. And that was like a news flash for me, because I mean, I had straight A's. Um, all of a sudden I had my first C in chemistry, and I was freaking out. I remember talking to the chemistry professor, and he was like, "Well, C's average." And I was like, "I'm not an average student." Um, but I think I realize now that the reason, and even then I didn't get diagnosed with ADHD in college, but I think that the reason I was probably doing well in high school was because I was running like 10 miles a day. I was in the cross country team, and I was in the dance team, and I was working. And so I didn't have time to like second guess myself. I would just do whatever I could, tight deadlines, do complete tight deadlines, do complete, and it was things I was passionate about. So of course I was gonna perform. And so then I get to college and I'm on probation. And when I wasn't doing as well, I sought the help of tutors. And I think because I could zone into whatever they were asking me, I was able to kind of prioritize, because for me everything was important. And so it then became easier. I went, from getting a couple of C's my first semester to then getting B's, and then doing okay and keeping my scholarship. And eventually I graduated with, really good grades. And towards the end, my last 2 years were all A's, or a couple of B's here and there, but it averaged out to a good thing. But my test taking skills were not always, especially the standardized, they weren't always the greatest, because I would run out of time. But just like I told my med school interviewer, if you given me the opportunity, I was gonna outwork anybody, because I really believed that my work ethic, because it was aligned with my passion to help others, I was gonna persevere. And it was actually during my first semester of med school where I was finally told, "Hey," my roommate said, "Diana, you go get checked out. There's something going on, because you're studying 80 to 100 hours and you're barely passing, or you're not passing. And when we get back your test, I'm looking at them and you put C all the way down, like the last 20 questions. Like, why did you do that?" And I was like, "Well, I ran out of time. I didn't want to, at least maybe 1 in 4 chance I might have gotten one of them right." And so she said, "Well, do you always run out of time?" And I'm like, "Well, yeah, I've always been the last one to finish the test. And I don't know if I'm second guessing, or if I'm, because I studied so much that it was too easy. And then I'm like wondering if it's really that. And I go for the one that I haven't heard, because I must have not studied that part."
Yeah. It's just
Or,
I'm relating on so many different levels, like to this point. And I also think like for people as adults, we take away like our coping skills that we had integrated into our lifestyle as kids, like if they're in sports or in extracurricular activities. And it's highlighting, I just wanted to stop and pause and highlight that, because in medicine in particular, we forfeit even our basic needs. And then we get to a point where we feel guilty for doing things that we enjoy, that can help us rest, that can be exercise. And I'm also an endurance runner. So when you said that, I was like, yeah, that's when I was a surgical resident. I would get up, I wouldn't sleep because I would sacrifice sleep in order to run, in order to function. But then I wouldn't function because I couldn't sleep. And you're creating all these trade offs where the things that could have been helping you to cope with this wonderful mind that you have and the things that are your strengths then expose a type of environment that no longer works for you because you don't have your key coping strategies.
Yeah, and so I went through the typical things that people are gonna say, the freshman 15, where you gain the weight, right? Because I wasn't running. So I went from like being so active to like just sitting and studying.
Yeah.
And then all of a sudden I started running and then my grades started improving and I
Yeah.
couldn't see the correlation.
Mm.
There, like now I can look back and see it, but around that time I had no idea. Like I was just trying to survive. I was just trying to keep my scholarship, right? And then when I'm in med school, I'm just trying to like not flunk out because in my mind like that was not acceptable. Like I had all these loans and like I
Mm.
could not fathom that even if I passed my test, like I still had to take my board test, and that there was still a board test that could tell me, like, it didn't matter how many hours you study, like, you still might not be a physician. And like, and so I knew off the bat that I might not become a physician. So just in case, I became a teacher before I graduated to teach science. But of course, I wanted to, and I when I was asked, and I was actually asked, "What are you gonna do since you're not getting into med school?" Like I was asked by my interviewer, and and I didn't even know I was talking to the dean who asked me that
Oh,
question.
interesting. Yeah,
And
and can we pause on that standardized testing? Because obviously there's, so much research that it's really biased and the things that you're talking about, like what is it? Because we have performance anxiety, we have ADHD, we have the second guessing because of confidence. I'm one, I mean, how many things I would fit in for those categories, but that second guessing, when you said if I know it too well, I second guess myself. I was actually even thinking earlier today, I would appreciated you bringing that up and normalizing that because I was beating myself up today for questions that were so easy on shelf exams I took in med school, graduate 2017, and still remember them because I was like trying to learn life skills, right? And you're like, wow, they were so easy that I thought there's no way. And I want to say this because I know it's common for people to say, just trust yourself. I was like, there's no way I can know it this well. It must not be that answer. And of course, it was likely that answer. And that's where I stayed just like you, last person in the exams. Standardized test taking is a challenge for me because I think we have to know it all before going in rather than learn how to actually take the test. So just really appreciate you bringing up those things because I know from different types of perspectives, people definitely resonate.
yes, and so like exactly what you just said. Like I had to find a way to, in my mind, make sense of it, quote unquote, know it all. So, like pages and pages of information, I would read and read and read, and like didn't matter. So, I had to learn that I had to make my notes in a certain way, organize them, and then I could spatially remember like all these things on this side are from this thing, all this the opposite. And then I could remember. But then like key things would jump out, like you're saying, and like things that I can still tell you, like from I graduated 2013, so it's been a while.
Right.
But because the way they put us through medicine is like you have to be able to think even when you're tired, when you're sleepy, when you're whatever, right? But I had to keep telling myself all throughout, I don't have 1 minute for my patient. Like my patient is not a board exam question. Like I had to keep telling myself that I just had to pass those exams to be able to then think about my patient. And sometimes with ADHD brain, it's not linear. And so because you don't know how you just know,
Yeah.
it's like you can't explain it to somebody, so you question yourself. Like,
Mhm.
and you don't know why you asked that question that nobody had ever asked, and you just discovered something, and they're looking at you like, "How the hell did you make that connection?"
Yeah.
I don't know. You're intuitive, or you walked in because you don't remember all the stories, so you just have to piece it together with how it fits, which sometimes it's a benefit because then you don't accept everybody else's diagnoses, and you look at it from like a fresh pair of eyes, right? And so all of that being said is that there's beautiful things about ADHD, but there's also things that get in the way when things appear to be a struggle with the boring parts of it. The all in, like, I can't tell you why I still remember like a month ago encounter word for word, but why didn't I do the note right there and then? Like, but it's like it's right there because I was so hyper focused. You and I, like, you're the most important person in the room. So whether it's 5 minutes or 45 minutes, like, I cannot tell. Like, it just blends in together. So it's cool because shit's going down and I'm cool as a cucumber, but
Mhm.
it's not cool when you're in the other room waiting for me. You're like, where's she?
Yeah.
Like, I've been waiting, right?
Yeah.
And so all those things later on, it was not until the last 2 years where I finally started to learn that I couldn't ignore my ADHD, because when I graduated from residency, I got told, "Hey, you're no longer, a student. Like, you're not even longer a resident. Now you're an attendee, and like you need to go seek like your own, you know, physician, your own psychiatrist." And so you would think in Houston, where it's like the medicine capital of the world, I would have just picked up any random psychiatrist and walked in and said, "Hey, I'm an ADHD. I'm a professional adult. Just refill my meds." But that encounter didn't go that well. Like, it was not even a 2-minute encounter, and they said, "You should know better. You're a physician. You outgrow ADHD." And they said, "You don't need meds," and they walked out. They're like, "You function to this far. You're not a kid. You should be okay." And they walked out, and I was sitting in the shame of this specialist telling me this. I was sitting in the shame of like, okay, well, I should just suck it up. Like, I got this far. Like, obviously, I did it okay. Had I been in a different mindset, I would have probably asked for a second, third, or fourth opinion, right? Because
Yeah, my heart
I'm
is
the
like hurting because I feel like this happens where people have to advocate. I even asked, for I read the book recently, Divergent Minds, and we talk about labels and things like that and how we feel about diagnoses. And sometimes I just felt that doesn't matter what the label is. It's like, this is how I function. How can you help me function given these facts? Right. And then when someone invalidates you saying like, these are the facts, this is what I need help functioning with, like, I think that's where we get in trouble, where diagnoses and other people have these preconceived notions and they use their biases against you and make you feel unheard, unseen. And to understand our truth and, like you said, learn when to advocate and know, like, now I'm really struggling, I need help, and finding someone. And it's for people that don't know, I live in the med center in Houston. So I know exactly what you're talking about. You think there's a plethora of people here, but especially when it comes to conditions that might be thought of as childhood conditions, or if there's a gender difference where people then think it's, oh, it looks like this and you don't look like that. Yeah, my heart hurts for you. So I'm sorry that you experienced that, and how it impacted
yeah,
you.
yeah. So it was painful, but most of us learn to compartmentalize.
Hmm.
I can't say the word.
Compartmentalize. Yeah, that's a hard
Yes,
word. It's super hard.
yes.
Yeah. Mhm.
Most of us learn to hide little pieces so that you continue to function. Otherwise, um you give yourself an excuse, right? And so I told myself, okay, well, it's a privilege to be here for these people. And if it takes 20, 30, 40 hours unpaid outside of work to do that, I will. And luckily, I chose well. I chose my husband well. um, he was one to never question how long or how much, or he allowed me to follow my passion, which was like a love-hate relationship because I love my patients, but I hated the administrative part of it. Like I hated the notes because my mind kept telling me that I was too slow, that I couldn't let my other physician friends know like how hard I was struggling, because then they would tell me that I wasn't doing it right. And so I would have to keep like masking like
Mhm.
how much work I was doing, like after work or on the weekends and stuff. And so even though I might have been off, I wasn't really ever off. Like I was, on my way to vacations and I'm like paying for the Wi-Fi to like it's an international trip. How many, you know, um callbacks can I do? How many labs can I do? How many notes can I close? And then you're pissed off with the internet because it's so slow. And then you get over there and you're like, okay, I'm just going to do like this for a few minutes. But like you can never really fully relax because you know that those notes are needed so that your patient can go get the help that they need with the specialists that they need. But then you're in your head and asking yourself, well, are they going to think I did enough, or should like I do more before I send them to the specialist? And so you're always like second guessing yourself. But all that to say that 2 years ago I found coaching, and I found coaching listening to podcasts because um of course, I always wanted to sit down and read, but I didn't have time to sit down and read extra stuff. But I was always listening to podcasts that would help me learn how to become an adult. Like I would listen to podcasts of like, as love becomes clean, or like how to organize, or how to declutter, or and then I found a funky one that was like unfuck your brain, and I was like, what was
Oh
that?
yeah, that sounds good to me. Mhm.
So I started listening to her. And then I think somehow she mentioned Katrina Ubel, who was a physician.
Yep.
And then I started jumping onto her. And I never made the connection that all these coaches were coming from the same sphere, like from the life coach school. And all of a sudden, I hear Katrina talking about Brooke. And then somehow I jumped onto Brooke's thing. And I thought I was like going crazy hearing like similar concepts, but they were all mind blowing concepts about how, we get to decide on purpose how we remember things or how we interpret things. And I was like, no, like this happened to me. This is how it happened. And I couldn't, and not until I heard on I just happened to hear the doctor's panel, which was on Bruce Castillo's thing, and she interviewed 5 physicians talking about life coach. And I remember thinking, what is that? Like, what are they going to tell me? How to work harder? Like, I already worked so hard. Like, that's what my brain kept telling me. But then I heard Sunny Smith speak, and she talked about her program. And at that time, I remember I almost vomited when I heard how much the prize was. But she talked about continuing medical education. And I was like, well, I get some CME money. Let me apply for that. Unaware I was burned out, unaware how things really were to me, that irritability can sometimes means burnout. Like I just thought that was what it meant to be a mother. I
Mhm.
just thought that was just part of the deal in the pandemic. So I did her program in October 2020, and through coaching, I actually had a couple of sessions with Sarah Smith, and we really dived into charting. And oh my god, I'm so glad we did. Like I went from having 200 charts open to like having them close, like within a few hours of me doing them, or with and I went from like 20 hours of charting, to like maybe 10, and then maybe 5. And then all of a sudden I started learning about like ADHD coaching, not just life coaching, but ADHD coaching, which I had never even heard about before, because I don't remember being told, hey, go seek a therapist. Hey, go seek a ADHD coach. Hey, like, I don't remember that. Maybe it happened, but I just cannot remember it. I just remember being told, here's some meds, good luck. And I remember feeling so guilty that the meds wouldn't last long enough. And didn't want to tell them they weren't working because I was afraid, because during those few hours that they were, like, I could get so much done. And I didn't want them to be taken away. And so the more, you get 8 sessions, private sessions through that program. And a couple of coaches said, Diana, I see you're trying everything. You're doing your meditation, you're doing your tapping, but you're kind of still all over the place. Like, you should just kind of consider again the medications. And they said it in a very nice, professional way.
Mhm.
And I was so glad that they did. And I started going to conferences to understand ADHD a lot better. And I remember sitting at one of I just a regular AAFP conference, and they had a 2-hour session on ADHD, and I almost like sat out of my chair when they like went word for word, like they walked the case through from like childhood to like what happens at when you hit puberty, what happens when you become the birth of your first child, what happens at menopause, and I was just like blown away that they kept modifying the meds at each of those stages due to changes in hormones, due to changes and stuff. And I was just like, what? It's a physician talking about this? Like, this is real? And that's when I said, okay, I'm the most important patient in this room. I need to invest in me. I need to understand me. I need to stop judging me. And those 10 years, I said, nobody has to do that.
Mm.
We're in a culture where we're told, just keep going. Just keep going. And you keep going. You put yourself in this hamster wheel that you're not even aware you're in the hamster wheel. You're not even aware that you are just living from a place of reactivity, that everybody else's like priorities become your priorities, and you forget that you were the priority all along, because we're natural givers. So we give and give and give. I remember I had started doing group coaching for ADHD. All of a sudden, I had all these hours I didn't even know existed. When
Yes.
I went
Mhm.
through Sunny Smith's program, I think I must have invested about 12 hours in her program per week because I would go and stay there for the 3 hours or the
Yeah.
4 hours she was
Mhm.
doing.
I've done her program, so I know, and I know Sarah Smith because whenever I hear charting, I think of that, and I'm a huge advocate. And even pricing, like you have it nicely laid out on your own website, is the price of the programs aren't for the 8 weeks. It isn't for the total 3 months or whatever is in the program. It's for life. So
Yes.
Sunny Smith's program, I had 2 podcasts. One person who also graduated from the life coach school is the physician philosopher Jimmy Turner, and EWP met me when I was the brink. I was very ill, and so when you say this, I'm like, they have a special place in my heart.
Yes.
This coaching can really drastically save and transform your life. And I'm just so glad that you invested in yourself and that you found those people, you're a part of that community, and just now kind of living it to give it.
Yes. Yes. And so I decided that it was time for physicians to start practicing medicine in their own terms,
Mhm.
and that it didn't matter what people thought or what the community thought the system should be, as long as the system yield what you needed to yield, as long as you took care of your patient, as long as you took care of you, as long as things that needed to be done were done in your own terms, from a place of you putting yourself first. And so slowly I kept looking, and I didn't see anybody who was saying that they had ADHD and were like a physician themselves. And so I decided, well, most of the time I'm either the savior or the problem child, because we tend to be so outspoken about things that are really passionate to us. And I decided that it was time for me to talk about mental health. And it was time for me to show people that, you know, all of us can identify with being a little late or can identify from getting those emails. But, you know, those physicians that sometimes seem to blow up out of nowhere, they might have ADHD and they might not even be aware, like I wasn't aware. Because, like I would say, it's like we have a list, and then that list is so unrealistic. Like if we got through all our lists, like we're multi-passionate, like we love everything. And so if we really got through everything, it would probably take like 2 or 3 lifetimes to do it. But in our mind, like we bend time. So it doesn't really matter. Like, and it's going to get done because we're going to find a way for it to get done. We don't like to take no for an answer. So we can be very stubborn at times. But I think that's what has been so helpful in helping me to become the clinic medical director of where I practice. I've been here for six years now, and the chief medical officer for the last year and a half. And so, and I was the clinic, the nursing home director, but as of January, I decided to uh, forego that obligation because my coaching business was taking off so much. I've actually been able to help 55 physicians,
Oh, nice.
yeah, in the last year in with my coaching program, and all ages from residents to like 63-year-old has been my
Very
elders,
nice. Nice.
youngest, wisest client, right?
Yes. Awesome. Yes. I love that. Yeah.
and and I know a lot of people are like, well, wow, why do they want to learn at 63? It's because we don't know. If you're like my grandma who lived till you're 90, like you
Yeah.
still want to have amazing time, like knowing what you
Absolutely.
didn't know, right? And
I'm very passionate about helping people to the very end of their life transition. Like that's, and even, whatever people believe beyond that. So I'm with you on that one. And
yeah,
I also wanted to pause just to say, I had so many people that when I first met and they were diagnosed with ADHD and what mental health in our culture sometimes means. And they would tell me, they're getting ready for interviews and they would tell me in a way that it felt like it was a limitation. But we heard all these great strengths that you just said. Like, I have ADHD. Here are the ways that it serves the team. It's very beneficial. Here are the things that I work with and like the obstacles that I face, and here's how I'm overcoming them, right? Like, here's the tools that I need or the extra support I may need, or if I do this, it might be that, and like explaining it. So I'm like, if we can just change our narrative and our mindset about how we interpret these diagnoses, then I think we can really highlight the strengths that people bring to the table because of the different ways their brain works.
yes, exactly. Because we tend to be the dreamers.
Mhm.
We tend to think outside the box. We create the table. If there's not a seat, we just make the whole table.
So
Like,
manifest it. Manifest. Here it is.
yeah.
Yeah.
And the thing is that we're gonna say out loud what you're thinking.
Mm.
We're not trying to, but it's just we won't live with ourselves if we don't say it. And so we say it. And so that could be seen as impulsivity, but it could also be seen as leadership, right?
Mhm.
Um, and so with there's a misnomer with the name ADHD because people just think, oh, they can't concentrate or whatever. But the things that you love, oh my god, do you hyper focus?
Yeah.
And so that's why, like in this last year, like I've been able to help all
Yeah.
ethnicities, like all like specialties. Like some of my clients have been family medicine, internal medicine, pain management, nocturnists, OBGYNs, pathologists, radiologists, psychiatrists, pediatricians, like you name it. Why internal medicine, of course, I mean emergency medicine. And again, it's because they don't realize some of them have ADHD and some of them don't. Like 90% of the people that work with me have ADHD, but the other people don't. They just feel like they're chronic procrastinators or they feel like time just gets away from them. And you'd be surprised what people who don't have ADHD have told me. They said, hey, I've implemented everything you taught and it's been amazing. They're like, in 15 years, the internal medicine one, med peds, she told me, I had never had weekends off, like truly weekends off. Like I always was doing something. She's like, but in the last 8 weeks, she's like, I've I actually have weekends off. Like it's dream world. She's like, but then my MA went on maternity leave and things went south. She's like, I really appreciate that I could see that if I didn't change anything. She said, I could really see how it could be that if you didn't have the right help on top of having ADHD, things can go south really quickly. And so she's like, I'm in the process of training my MA, but she's like, I have a new understanding of what it's like, all the challenges and all the gifts that people with ADHD can have because again, we are going to do that extra work because we want to, not because we feel we have to, but it always can get us into a little bit of trouble when, you know, uh, there's deadlines. And so in my course, I try to teach people that, we all start with a full battery in the morning most of the time, and throughout the day, as you make decisions, your battery gets lower and lower. And so you have to be aware that short-term memory, even though you think you don't have good short-term memory, this goes for everybody. Short-term memory is always going to be stronger right there and then. So the goal would always be to close your note as you go before you jump onto the next patient. And I know sometimes we're like, well, my patient is really complicated. And they can be, but you can still give yourself those 3 to 5 minutes before you walk into the next patient's room to dish out your assessment and plan, because that tends to be the most complicated part of it. Like later on, we can come and fill in the gaps. And I try to give myself as many nuggets, like on my assessment and plan, I might put like right foot, leg, golf size, left tibia, like so that I know exactly where when I go back. And I'll put like Bactrim given because allergic to XYZ, or diabetes uncontrolled, A1C of 12, no changes, patient non-compliant 2 months. So like I try to tell myself so that I can then use that for my HPI a little bit so that I don't have to reinvent the wheel.
Mm-hmm.
And it's faster to close it later on.
It's resonating deeply because in residency, I was very burnt out. I switched from surgery to a new residency, military. So in my second residency, I hadn't given myself, I went from discharge military residency resignation to starting my next residency the next day because we're a physician, right? We don't take time off. We just think that's like an acceptable thing to do. I also don't think I was ready to like grieve and whatnot. But in that second residency while burnout, I just remember the charting being such like a mental and emotional burden because my patients would come in with like a very detailed history, and patients can read their chart. And you feel like you have to get all the details in there. If you're perfectionistic, you can procrastinate and feel like, or the fear of litigation, like whatever it is that can lead to procrastination. I literally said I can only do clinic half the day, and part of it was to reduce the amount of charting because it would still take me till midnight to finish, to sit down and finish. And I remember opening the charts, and if I had put the details like you mentioned, I would feel relief. I had already got it. If I opened it and it was like 2 sentences because we were running around the clinic, I just remember like the such a difference in emotion. I was like, oh, and I had to go back because Sarah Smith would say this was a horrible thing, but I would write it all down, and she doesn't want you to be redundant. And I would write it down and then transfer it. And so, but we don't want to be rude being on the computer. So I just appreciate you bringing that all up because I know the charting resonates. It's something that continuously comes up, especially as people are like, I don't think I can handle clinical medicine. And when we say why, it's like charting takes me forever.
Yeah, it felt like death by 1,000 clicks, right? You click here, you click there, you click there, and you're like, okay. And there's data out there that shows that, I think it was a Medscape article that it showed that most physicians, regardless of what specialty in the US, you're charting about 4 hours, like 2.5 hours a day, and maybe like 4 hours outside of work. So it happens. It really does, because there's all these check boxes that we're supposed to do sometimes, and we don't understand, and luckily now the payment has changed a little bit if you're primary care. So now if you understand that, then you know you don't have to put so much detail because it's built on time or complexity, right? And so if you understand that, then it's easier.
Mhm.
I mean, it's still work, but at least now you're a little bit smarter on the work that you're doing.
100%. Yeah, and learning your EHR as much as you can and just becoming trust that you can become a machine when it comes.
Yeah, and learning that, yes, sometimes you do have to slow down. Like I have to tell people, you do have to get out of that wheel, hamster wheel, and you have to wait to get you on the car with the GPS, then you can go. And that what that means is that maybe you do have to make some smart phrases. Maybe you do have to make some templates. Maybe you do have to learn to use Dragon, or maybe advocate for Scribe. Like there's not a right way. You just have to figure out what's your way, and then you figure it out. So I think I've been so blessed to be in the position that I am in medicine, because then I could, as I started to create my systems, I said, ha, we're doing this for everybody. So we're not going to send the doctors and the nurse practitioners 10,000 like stuff. You refill them, look at the thing. Everybody gets 6 months. If they haven't come to see me in 6 months, give them 30 days of medications, order the labs, have the patient come in. Like it became a standard so that they're not asking what they're doing for me, what are they doing for them, what are they doing for that. You started to create the system to support the physician, right? And like, why are you sending me a callback asking me to refill the medicine, and you're not telling me that you're which medicine, you're not looking into the chart to see if there's actual refills there. Why are you sending that to me? So I had to educate them all. No, do your work, then come at me. If it's a controlled substance, print out the control medical, da 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 da. Show me when it was the last year, and da da da. Like, know everything. Give me. So all I'm saying is yes or no. Don't make me go and click on 10,000 things. And so I'm really wanting us to learn to advocate for ourselves. And I know that we're short staffed most of the places right now, but people can learn skills, and you just have to be willing to teach them how they can help you. Because if you think that only you can do it, you're wrong. Your job is to see more patients, but it's not necessarily to be in the computer more. So somebody can help you to get all those other details in there.
Yeah, and I think this comes up for like all different whatever physicians are doing, it comes up in the entrepreneurial space too. And I think it's a combination of what we learn, especially if we want things to be perfect, we think we need to control it, and how that actually can result in less perfection because we get burnout, and then our time we're spread too thin. You can't really, that's not realistic. And I would love to hear more about your coaching program and what it all entails.
Yes, thank you for asking. So, while I mentioned that part of it is with charting, it's not necessarily all about charting. It's really meant for you to reclaim your time. So we're going to talk about like planning, and we're going to talk about batching, and we're going to talk about how to have create tools, easy tools for you to manage and use your emotions as a compass and process your emotions, not necessarily just swallow them down like we're used to. Practice self-compassion. We dive into how to tame the in basket, and how to create the systems for creating time for your passions. Because most of us think, well, I'll do it after I complete say tasks, but you don't realize that if you schedule your time for fun or for whatever fuels you, you will be more efficient, because now you have dopamine. Whether you have ADHD or not, now you're motivated to really respect your time off as off. And so it's really cool in the sense that I bring in 4 guest coaches, and they're different coaches, like depending on which cohort. Like I bring in most of them are physicians, but the cool part of it, so I'll bring in a sleep coach, or a meditation coach, or a yoga nidra coach, or a nutritionist coach, or I brought in like lawyers so that they can teach us about the implications, whether you should disclose or not a diagnosis, whether um, how you should navigate like practicing as an entrepreneur versus not. And so I try to bring really cool tapping coach, like I try to bring in really cool
Oh,
coaches.
nice. Yeah.
But one of my favorite ones is part of the program comes with a declutter coach. So she will actually come and help us figure out our style. So we
Oh,
go through a quiz that it's like clutter bugs. There's 4 different bugs. And so based on your style, then she'll say, okay, well, if you're a ladybug, then you like to, clean the kitchen this way. And so we'll go through the kitchen scenario, or then we'll go through paper clutter scenario, or we'll go through like laundry scenario. So it's different ones. But then part of the program comes with 3 private one-on-one sessions with her. So she'll help you declutter whatever you want.
wow.
And so part of the course is, I call it declutter your brain, declutter your life. And so we get rid of the thoughts that are holding us back, but we also get rid of the things that are decisions that one time served us, but are no longer serving us, and are a constant reminder of what a wrong choice that was, or whatever it is that our brain tries to offer it, not from a place of judgment, from a place of like, well, that was needed in that moment in time, but that system, you have outgrown it. So just let it go and move on, because now you're a step wiser now. And so that comes from me again, trying to control my kitchen, trying to control things. And oh my God, it's so freeing to finally throw all those journals, that medical journals that we have not like opened up in how many years. And so we go through all that,
Mhm.
and it's just an environment where you can come and be. It's just strictly for physicians, and it does come with CME. So it's a win-win. And of course, I can send you the flyers so that, it's all written in the pain point of the
Mhm.
hospital or employers, what they want, which is to prevent burnout, which
Right.
is timely charting, timely communication, team building. But really, at the end of it, you come out a different person. Like, you come out understanding that you get to decide on purpose the life that you want, and you get to see that the lessons you've been given have been lessons that you needed, because it still got you here. And then it's so much about, what do I have to unlearn? Because there's so much that we learned that we didn't realize that maybe it wasn't helpful. And when you don't really prioritize your mental health, you don't even realize that you're irritable and frustrated and all that could be that, all of a sudden the body's going to get what it needs from different sources, right? It might be through food, it might be through drinking, it might be through smoking, it might be through shopping, it might be through different things. And so I know that sometimes when we hear mental health, most of us think that, oh, that's not even anything we should be talking about. But the thing is that COVID made it very clear that we were probably all sub functioning.
Mhm.
And it really stretched us to pay attention, because all of a sudden we were faced with making decisions that were gonna not only impact you, but impact your family, right? You might bring something to them, and who knows, right? I was so mad for a period of time having to make a will, and maybe losing my 1 and 2 year old for a profession that I chose. I never said put my family at risk. It was always do no harm to the patient. But where did it say do no harm to my family, right? And so I say all that to bring it back to that coaching exercise. Everything has a way to get you to where you need to be, but you need to be able to invest in yourself, because if you don't, then your family pays for it dearly. And that's the other thing. Like, sometimes they don't say anything, but why is it that they get the best of us at work, and then you come home so tired and irritable? Like, you're doing it for them so you can come and fulfill at home too. So, and I know sometimes we sacrifice one part for the long game. But what if on purpose you chose joy and peace every day, even if for a few minutes, right? Because now I've really learned to use tapping to do that. Like, when I feel like I'm about to like say something I shouldn't be, and now I understand there's a name for it. It's called rejection sensitivity dysphobia. So, and might sound like an excuse, but it's not an excuse. I mean, it's not recognized in the US as a diagnosis yet, but in Europe, it's really being studied for the last 40 years. And in Europe, they actually use that to equal emotional dysregulation. And so, whenever we're faced with so many decisions at once, we get overwhelmed. And because they all seem important. And so we can get irritable and we can snap. And now I understand that. And so now I understand that, okay, I don't have that 2-second delay that everybody else who doesn't have ADHD has. The amygdala does not keep up. So I don't make him anything. Now I just hold my breath and then I say, give me a second. And then I answer what they have to say, or I finish my thought, or I'll go to the restroom, do a 3-minute meditation or a minute meditation, and then the rest of my day does not go south, because otherwise it would have. Because we know how it is. We can get one patient and it derails us, right? Like longer than we expected, or something that we didn't need. So rejection sensitivity dysphobia, if you have somebody around you that you see seems to have little microfires, and all of a sudden 5 minutes later they're cool and cucumber, think of ADHD. Because that's what might be going on. 100% of the people who have ADHD suffer of this rejection sensitivity dysphobia. They like have outbursts on what you think, over exaggerated. You wouldn't have thought that that would have pulled them over the edge, but they do. And then 2 seconds later, they're back. And so it's not anxiety or depression, because they would have to prolong that for 2 weeks or more. This is just like in and out. Like within 5 minutes, they're back to their charming self. And then you're just like, are they bipolar or something? But they didn't even realize, because it was so quick for them, that then they're over it. And so just look around, because if you help somebody make the diagnosis, it might really change their life. Because if they can get treatment for whatever it is, whether it's anxiety, depression, you could really save their life, and you could really impact the way their family is functioning and the way their patients get even better care. Because like I said, we're going to sacrifice ourselves for the patient, but we shouldn't. We need to prioritize ourselves as the first patient in the room, so that then we can even provide support care for them.
Yeah, and I think that's such a great lasting point to end on, because that's what it's all about. And also, like, because our whole discussion has been ADHD, and you made such a great point at the end with, if someone's doing something, yes, it definitely could be ADHD. And what we observe is it sounds like that person needs support somehow. So whether it is ADHD, whether they are struggling with something that can be diagnosed as bipolar, whether it's grief. I lost my ex-boyfriend during residency, and I had anorexia, and it's like people just don't know what's going on. And then that extra layer, like you said, of having a lawyer that helps you navigate how to even talk about it, which seems so unfortunate, because then it creates this extra stigma that we absolutely don't need. But it's finding, what do you truly need? Don't, and as you were mentioning about yourself, like, no judgment, and that increased self-compassion. They have the opportunity to work with you on coaching and improving that situation. And what do you need in this moment? And I think what's important too is that people might listen, and we talked about prices of programs and things like that we invest in. And some people will say, well, that's great for them, but they go on their way. And I just want anyone that thinks like, yeah, coaching's great for some people, but not for me for whatever reason, just to say, why not me? Oh yeah, well, it sounds great to put everyone else, to put myself first, but I can't do that. Why not you? And how can we make it you? So for anyone who might not be watching and who's just listening, I want to have them hear, what is your website and how can they find you?
Yes, so it's adhd-lifecoach.com. And if they would like to follow me on Instagram, or want to check out my podcast, it's called Beyond ADHD, A Physician's Perspective. And so I talk about what I've been through, and I interview a lot of my great friends, and we talk about all things parenting, because you might not have ADHD, but you might have a kid with ADHD, or stepson with ADHD, or you have a colleague with ADHD. So it's so good to be able to be there for them. And it's the ripple effect, right? And so, yeah, just open yourself up to looking at this, because unfortunately, females, they have, most of them, the inattentive type. So they get missed because there's a quiet person in the back of the room that's not cussing the ruckus like I was, And so, and even like when I got missed, right? Because most of us get diagnosed after the birth of the first child, or after you hit a ceiling, like you go into med school or law school, or you become the CEO of something, and you have all these like extra levels of executive function that you need to be doing, or you hit menopause. And so there's all these changes that could happen. So always keep an open mind. Now I make it customary, whether they're coming for anxiety, depression, or whatever they're coming for, they are doing the 3 questionnaires at once. I'm not asking them, they're just doing them. You'd be surprised how many people I pick up because of different things. And they, yes, they can coexist, but sometimes they're frustrated and depressed because they can't do what they want to do, because they feel like they know they know what they want to, but they don't know how to. Like, now it sounds silly, but you become almost paralyzed sometimes when you're like, but there's so much to do, where do I start? And so you'll do it, and that's why deadlines, it's like the short deadlines are good, because then they get you to get on, but then you pay for it for the next 3 or 4 days after that.
Yeah. Well, thank you so much, Dr. Mercado, for joining me today, for sharing your story, your insights, and all the valuable resources with the audience so that people can find you.
Yes. So, if one last thing, if anybody wants me to come talk to the residency about how to identify ADHD, or any charting or compassion or any talk, please reach out. I'll be glad to come and help, because together we can impact lots more, right?
Yeah, absolutely. With everything that you talked about, the first time I talked to a psychologist for test taking was in medical school. It's so late, so it really save a lot of suffering. With the emotions you've gone through that you were mentioning today, just save so much suffering if we can get the support earlier. And if you are later in your life, it's not too late to get the appropriate support you need. So thank you so much for bringing that up. I appreciate it. We'll certainly make sure that all your contact information is below. And make sure to leave your questions, comments, and reach out to Dr. Mercado for her speaking, for her coaching. Let her know she's awesome. And we appreciate you. Until next time.
And again, thank you for doing this, because people need to hear.
Absolutely.